So what happens in spondyloarthritis? So this is a normal knee joint. In the normal knee joint, this is what the various structures look like. So the place where a tendon or a ligament meets the bone is known as the antisis. Bone is the substance that forms the skeleton of our body. Ligament and tendons, they are connective tissue, and one is more flexible than the other. One is more elastic than the other. And then here you also have the articular cartilage, which is the smooth white tissue that covers the ends of bones where they come together to form joints. And synovium is just this lining over here that lines the inside of the joint capsule. So in enthesitis, inflammation occurs at the antisal sites here, where, as mentioned earlier, a tendon or a ligament joins to the bone. And these affected antisal sites may be within the joint, such as in this knee joint, or it may occur distant from the joint, such as the Achilles tendon and plantar fascia in the ankle, which is at the ankle but not within the ankle joint, which is here. It can also occur near to but not within the elbow joint, and it can also occur in the spine, which is what we see in axial spondyloarthritis. In axial spondyloarthritis, the spine is predominantly affected rather than the joints in the arms or the legs. The inflammation at the axial skeleton can occur at the sacroiliac joint, which is this joint that connects the bottom of the spine to the pelvic bone. And this is known as sacroiliitis when there's inflammation in this joint. Or it can also occur in the vertebra, which is the bones of the spine. And then this is what we refer to as spondylitis. Sometimes these patients may show minor features of peripheral spondyloarthritis. So in peripheral spondyloarthritis, the predominant involvement of the joints is in the joints of the arms, legs, heels, and sometimes the entire fingers and toes, like dactylitis is what we went through earlier. But similarly, some of these patients who have predominantly peripheral arthritis may also have some axial involvement and may also have mild back pain. So all patients with axial spondyloarthritis and some people with peripheral arthritis do experience back pain. For axial spondyloarthritis, there's a wide spectrum in terms of pain and disability caused by the disease. In people with non-radiographic axial spondyloarthritis, the inflammatory changes typically do not show up on the sacroiliac joint X-rays, although some may have mild X-ray changes which are classified as suspicious changes. However, in these patients with non-radiographic axial spondyloarthritis, they may have changes of inflammation in the sacroiliac joints and spine on MRI. So unlike X-rays, which only show the bones, MRI can show much more details within the bones, joints, and also other tissues such as the ligaments, tendons, and muscles. So in ankylosing spondylitis, the sacroiliac joints can be seen to be clearly affected on the X-rays, and there are very definite inflammatory changes, which are much more severe than that seen in non-radiographic axial spondyloarthritis. And some people with ankylosing spondylitis may eventually develop spinal deformity. This may occur as the ankylosing spondylitis AS worsens, and there's persistent inflammation at the antisil sites in the spine, following which new bone actually forms as part of the body's attempt to heal. And the new bone gradually bridges the gaps. There are actually supposed to be gaps here between the two bones. But when new bone forms with persistent inflammation in AS, the new bone gradually bridges the gaps between the vertebra and eventually fuses sections of the vertebra, which is the different bones, together. And fusion of the different vertebral bones in the spine can flatten the natural curves of the spine, and which may result in an inflexible hunched posture. So generally in ankylosing spondylitis, we will expect there to be more severe X-ray changes, and people affected may develop spinal deformity.